Congratulations. You've gotten into medical school. Congratulations, grandparents, parents, friends, lovers, husband, wives, congratulations. You helped us on this journey, but the journey's not complete. So you say you wanted your child to be a doctor. They're in medical school, not quite a doctor, but we're going to talk about the different nuances of medical school. In the next video, we're going to talk about a mindset. But just to set a tone, I'm going to put this out there. It may not make sense until later as they matriculate through medical school. Now that you're in medical school, the reasons why you wanted to go are actually whatever your reasons are, and everybody has different reasons. Whatever your reasons are, great for you. But as you go through medical school, and moms, dads, spouses, you really have to think about this. How you go about deciding what you're going to go into, there are a lot of variables to it. For instance, if you have a person, your loved one, or if you are that person, that you've always wanted to do X, whether it be surgery, pediatrics, you've always wanted to do that. That's been your lifelong dream. I would highly recommend you do that. Whatever the pay is, whatever it is, I highly recommend you do that. But if you're like the vast majority of students, open your mind. As you matriculate, look at all the different specialties. Keep your mind open, but as a general rule, and I'm not sure anyone's going to tell you this, so we're going to talk about money for a minute. As a general rule, the specialties that do procedures get compensated more. Yes, the specialties that do procedures get compensated more. Procedures being surgery, spinal taps, intubations, meaning something that anesthesiologists do. There's a host of different procedures. The more procedures someone does, the more they get compensated. In other words, if income plays a role in your decision of what you want to go into, keep in mind, look for specialties that you will enjoy, but that do a lot of procedures. Some of you should be laughing, but I told you, medicine's conservative. You, your loved one, your child, your grandchild, they may go through medical school, choose a specialty, and no one ever talks about compensation and money. Medicine's very conservative, so I would encourage you to listen to my words again. You will be more informed than 90% of other loved ones, parents, spouses, and supporters. If income plays a role in terms of what they choose, specialties that do procedures tend to make more. Now back to medical school. Let me set it up for those who are not going, those who are the supporters, those who have been on the journey with us, because the ones who are going probably already know this. The courses they would take during those first 2 years are what we call the basic science courses. They include biochemistry, genetics, pharmacology, physiology, microbiology, anatomy, with a lot of the undergraduate courses interwoven. The chemistry that we took in undergraduate will be interwoven, the physics, the mathematics, all that will be interwoven. But those are the core basic science classes. And by the way, for the supporters and for those who are going, the first 2 years, those are the most difficult years for most. But it's more so a personal, emotional battle. It's you dealing with you and dealing with the emotions and the intensity of medical school. But let's go back to one of our quotes. The man or woman who thinks they can and the man or woman who thinks they can't are probably both right. You've been on a 1,000-mile journey. You should now be leaning towards I can. And when in doubt, we never ask ourselves, can I do this? What do we ask? Is it possible? Because is it possible, especially the stage and the journey that you've been on? The answer is always yes. Let's talk about third and fourth year. There are core medical disciplines that each medical school have their students rotate through. They include internal medicine, pediatrics, general surgery, OBGYN, and psychiatry. Again, internal medicine, pediatrics, general surgery, OBGYN, and psychiatry. And just as a side note, I know that most people listening to this know this, but when people talk about primary care, they're usually talking about internal medicine, pediatrics, family medicine, and plus or minus sometimes OBGYN. Third-year medical students across the country will rotate through those electives. During that period of time is when people start to get a feel for what they want to go into. During your fourth year, you have your specialty electives. Usually, for most medical schools, they rotate through internal medicine again, and then through various specialties. Just to share with you what the general specialties are overall. You have emergency medicine, which usually has a residency of 3 to 4 years. You have internal medicine, a residency of 3 years. Pediatrics, a residency of 3 years. Family medicine, a residency of 3 years. Then you have the anesthesiology, adult neurology, psychiatry, physical medicine and rehab, ophthalmology, radiology, obstetrician and gynecology, dermatology. For the surgical specialties, you have urology, which is usually 5 years, general surgery, which is usually five years, vascular surgery, 5 to 7 years, neurosurgery, 7 to 10 years, plastic surgery, 5 to 7 years, thoracic surgery, 6 to 7 years, and if you choose to subspecialize, there are additional years tied to this as well. Those are the various specialties, but during the fourth year, you don't rotate through those, but you get exposed to those during your fourth year. Because it's very important for you to have some kind of exposure, or look at it this way. It's very important for you to be an active participant in choosing your future. In other words, find a mentor, find a sponsor, find someone who will spend a day or a half a day and simply show you the magic of their field. You may choose not to go in there, but have someone who has a vested interest that they only want to show you the upside of their specialty, because it gives you a larger breadth of knowledge to draw from as you go about choosing your specialty.